I'm Angela Smith, Doctor of Physical Therapy, and today I was going to talk about some exercises for pelvic stability. So if you get some pain in your back, kind of at that belt line level on one side or the other, then it could be from an SI issue or your sacroiliac joint. So if you know that you have some problems with the alignment in your pelvis or stabilizing your pelvis, these exercises are great for that stabilization of the pelvis. I like to give exercises that have multiple muscle groups involved, so we get co-contractions of multiple groups to help stabilize. So I'm going to show you some of those exercises that you can do for that. One exercise that you can do is just to grab a tennis ball or a racquetball and use it to help massage those tender areas or sore spots. So you can just lie down on your back and you would put the tennis ball underneath you, especially right by that SI joint, not on the bone, but just right off of it. And then you can just rock your knees back and forth, feel that ball kneading into that area that's sore and tight. So that can help release some of those tight areas that around that SI joint. And then you can do some other exercises to help stabilize that pelvis. Okay, so for the first exercise that we're going to do is a pelvic tilt. So you lie down on your back, and the key to this exercise is you want to flatten your back into the floor. So as you tilt your pelvis, you're squishing your back into the floor. So if you if you put your hand there and you tilt your pelvis back, you should feel pressure increase on your hand. Or sometimes I'll tell people, think about squishing a little foam ball under your back. So you're pressing down into that. So you can see my pelvis tilt. And then once you get good at that and holding it for 5 seconds, then I add another one to it. So while you do the pelvic tilt, you need to make sure you keep breathing, but you should feel a tightening here, sometimes a little bit of activation in your glutes. And then we're going to add a squeezing action with it. So you can either grab a little ball or a pillow, and you're going to fold it between your knees, and you're going to squeeze the pillow, so we're working those inner thighs while we do the pelvic tilt. And hold for 5 seconds, and then relax. Squeeze and hold, relax. And I have patients do that for 5-second holds and do about 15 of those, and then you can work your way up in sets to increase the repetition. The next exercise I have people do is a bridge exercise. And you can combine this with another exercise of tying a band around your knees and keeping your knees apart so you get that co-contraction. But if you don't have a band, you can separate it out into 2 different exercises. The first one is just a bridge, and you want to make sure that you just go to neutral. You don't want to hyperextend where you're getting too much extension in your spine, in that low back, but you're just going to lift to that neutral place, or back off even just a little bit more if you have pain. But you're just going to do slow controlled motions, working those glutes and the extensors in the back, and do about 15 repetitions of those. So if you don't have a band to work these outer hip muscles, then you can do a clamshell where you roll on your side. You want to make sure your hips don't roll back as you do it, but keep that hip pointing up towards the ceiling. And your ankles and your hip stays still, and you just open up your knees like a clown. And it's not a big motion, but you'll feel that right over here in these muscles on the outside of your hip. And do, again, about 15 of those, and then switch and do the other side. And then the last exercise I'm going to give you is a pelvic floor or a Kegel exercise. Some people say Kegels, but it's a pelvic floor contraction where you lift the pelvic floor up and in. And you may think, why would I need to do that? But the pelvic floor muscles are all on the inside of that pelvic bowl, on the inside of your pelvis, and they all run together in there. When you do a pelvic floor exercise, you shouldn't see any other movement anywhere else. You shouldn't see your compensation up here of trying to squeeze down there. You're not doing like a sit up with it. You're not squeezing your thighs together. You shouldn't see any movement. You shouldn't even know that someone's doing it when you're looking at them. And you hold for about 5 to 10 seconds and then relax. If you can't hold it for those first 10 seconds, then you can work your way up to doing it longer. When you do those pelvic floor contractions, you want to make sure you keep breathing. And then you do about 15 repetitions and relax, and then you can do another set and work your way up to like 3 sets of 15, holding it for 5 to 10 seconds. I want you to be able to isolate the pelvic floor and do that Kegel really good on its own before you add it into the other exercises. So when you get really good at that Kegel, then I would have you add it in while you do like a bridge, or add it in when you're doing the pelvic tilt and the squeezing. So then you're getting multiple contractions of multiple muscle groups to help with that pelvic stability. These exercises would be exercises I would give someone right off the bat. They can progress from here, but we would start with these basic exercises.